Thank you for joining us today. This is a great celebration, and it's a great recognition, and it's an important moment in our fight against COVID-19 here in Connecticut. Today we're recognizing 100,000 tests. On Sunday, in fact, we surpassed 100,000 tests in Connecticut done by Hartford HealthCare and by our team. And I want to recognize we have 150 staff members who changed their jobs in March, stopped doing what they were traditionally assigned to do, what they were trained to do, and volunteered and said, we will join the new entity we created, HHC Testing, and we will commit to whatever's necessary to do testing for our community because it's what mattered most, it's what continues to matter most. And these 150 people, they are part of the heroes we recognize in healthcare. So I just want to give them a round of applause, please. Incredible people. We are so grateful for what you do. Today, we're talking about containment, and testing is absolutely vital to containment. So we're doing a mobile unit here today at Doncaster, a senior living community with a nursing home. We have done 120 places like this. We've done churches, we've done community centers, we've done schools, we've done homeless shelters, all types of congregate living environments. 120 different times. People left different facilities across Connecticut within Hartford HealthCare and dispatched to where the most vulnerable people within our community are so that we could bring testing to them. And that is absolutely essential to the response within Connecticut. So today I'm joined by two great leaders within our state. Governor Ned Lamont has been an incredible partner to us, and Senator Doug McCrory, where we are in his district, who has been a tremendous advocate in particular for testing within our community and to the populations, the people who are most vulnerable. And we're very grateful for your support. There are today 10 units set up across Connecticut within Hartford HealthCare that are fixed units. And then we have 5 units that are set up and deployed so that we can be on the road and respond based on data, based on need, based on risk every single day. And I saw a statistic yesterday that was brought to my attention. Of the 50 states in Connecticut, Connecticut ranked first, number 1 out of 50 within our country for the lowest risk of transmission for a person who tests positive. So in Connecticut, a person who tests positive was 0.86. So they would effectively pass the virus to on average, less than 1 person. And there are states where it may be 5 or 6 people who get infected by a single person. That's an incredible statistic. That statistic is a credit to this governor, to the response from this state, to the partnership that has been built, the leadership, the decisiveness, the pragmatic approach, and decisions like we stand here today, building drive-through testing, building mobile testing, and doing whatever was necessary around the application and acquisition of personal protective equipment. But Connecticut today, at least up till this point in time, stands as a national leader in terms of the statistics and how we've been able to this point to contain the spread of CV-19. Now, this is about vigilance. It's about maintaining our highest level of alert. And I want to speak to just 4 specific areas. First is testing. Testing is critical. Testing helps us contain, it helps us identify people who are at risk of spreading the disease, allows us to quarantine people, allows us to do contact tracing. Testing is critical. And we've created free testing in our state so broadly, so well distributed, and we need to continue to encourage anybody with symptoms to be getting tested, and we can test people today who are asymptomatic. Secondly is around hand hygiene. The important need around hand hygiene. We learn this at a very basic early age in our life, but absolutely critical to have proper hand washing, proper use of disinfectant. Third is to follow the guidelines around social distancing. Absolutely critical. We've been very attentive at the state level to provide very clear guidelines. It's measured very specifically, routinely, and it's been critical to why our state has performed as well as it has. And the fourth issue is wearing masks. Wearing masks, particularly indoors and in any high-risk setting, absolutely essential. And lastly is paying attention to the state's guidance around restrictions around travel and around exposure into areas where there's higher risk and higher incidence rates. So I have to tell you, we need to maintain this level of focus, this level of alert. This moment with 100,000 tests is critical, but we're going to continue testing every day, continuing deploying our tests to the people who are in most need, where there's greatest vulnerability. But I do want to recognize Governor Lamont. Governor Lamont asked me to co-chair his health system response and readiness task force in early March. I've been shoulder to shoulder with Governor Lamont. I've been behind closed doors with him. The integrity of which you've handled this, the way you've just simply done the right thing, the lack of attention to politics, quite frankly, and the certainty of just trying to protect the community. We've had at the health system level across Connecticut a tremendous partner. We have been able to bring PPE here. We have been able to mobilize resources. We've been able to set good policies. We've been able to adjust accordingly because there's so much ambiguity here. There's so much we don't even know. And that's where the governor's leadership has flourished, because we've not been wed to decisions. We've just done at the moment with the facts as they're presented the right thing. And we within the healthcare systems across Connecticut could not be more grateful for your leadership, your partnership. We are tremendously grateful. And I'd be remiss if I didn't point out that this is from the first days Governor Lamont entered office. It very much predates COVID-19's emergence in our community. The very first things Governor Lamont did was reach across to the health systems and said, how can I help you? And recognizes the need for a strong public health system in Connecticut. So, sir, we are so grateful for your support, and it's an honor to be here with you today, and we would never have been able to do 100,000 tests if it not for your leadership. Thank you.
Well, right back at you, Jeff. It's been a really great partnership, especially good partnership with the Hartford Health and all the hospital systems. Suzette, your mayor here, we work closely with the mayors to get the message out every day so we can talk with one voice what it takes to keep COVID under control. Doug McCrory, your state senator, working closely with the legislature to make sure that we implement what we've got to do. But talk about partnerships. Where's Dawn? Where's Dawn?
There she is.
This is the partnership that really matters. And Doncaster, if you haven't gotten your test yet, don't keep Dawn waiting, because she gets lonely and wants you to be there. I understand that everybody has been tested here, right, Dawn? And right now the infection rate, blessedly, is really low. And Jeff, I would just say we wouldn't be top 10 in the country when it comes to how much testing we have done per capita if it wasn't for Hartford Health, if it wasn't for 100,000 tests that you have done, if it wasn't for the fact that you come to Doncaster, you go to the homeless shelters, you go to the churches. We have over 160 testing sites around this state right now. Hartford Health is a big piece of that. And we're trying to do everything we can to convince people, go get tested, no questions asked. That's why we have the lowest infection rate in the country right now. We have the lowest infection rate in the country. We're taking this seriously. And to be able to do as much testing as we do with a low infection rate and the number of people who are asymptomatic makes a big difference. There's a wonderful guy named Rick Porth. I wanted to say something about him. He's our United Way contact. I've never met him. We get together on Zoom with all the commissioners. It's called the United Command Call, and he gives a briefing on 211. A lot of guys get polls. I listen to 211. That's our hotline. That's the telephone number. That's the email. That I get a sense of really what's going on in people's minds since the early days of this pandemic. That's where you can call if you have any questions at all, 211. That's where you can call if you go to a store. You don't think they're taking the mask regulations seriously. Report them, and we're able to take care of that. And Rick said something very interesting. He said, obviously early on everybody was terrified about the nature of COVID-19. And then they were really worried about unemployment compensation. And then it was lots of questions in terms of stress and social isolation and young people calling in just for somebody looking to talk to. And as you maybe know, over the last month or so, and things have been going pretty well in Connecticut, and Jeff knows all too well, and Dawn probably knows as well, we've had extra capacity. We've had more testing than we've had people necessarily wanting to get tested. They thought, maybe this thing's behind us, maybe I can skip the test going forward. Well, what Rick told me on the 2-on-1 calls in the last week is people look around the country and they see what's going on in Florida and Arizona and Texas. They're signing up again and they want to get tested. And you can go to this site. You can find where half the sites do symptomatic and asymptomatic. A number do antibody testing. You'll find out exactly where it is, punch in your zip code, and we take care of that. I'll tell you, I see Chris Keating from the Hartford Current here. And the Current today, I was reading the headline, Chris, and it talked about testing in other states. And I think you called it a hot mess in other states, a hot mess, where people don't know where to go. They're waiting in long lines. It's 4 or 5 days to get a test, long time to get a result. That doesn't work. And thanks to Hartford Health, thanks to our incredible partners across the state and the other healthcare, thanks to the mobile labs you're taking, thanks to the fact we're getting testing out to the people. So far, we're on the right side of this curve. Every day that we're making a difference. And I'd be remiss in saying we wouldn't be anywhere if it wasn't for each and every one of you and how serious you are about wearing the mask. Thank you. And Suzette, Doug, would you like to say anything? Or Dawn, would you like to say something?
Dawn, please. Okay, very briefly. First of all, Jeff, thank you for all the service you're doing from the hospital level, and Governor, your leadership from the state level. But more importantly, I want to thank those essential workers, those individuals who put their lives on the line to make sure our people are safe and have the testing that they need. You guys are the heroes in this battle. And again, real quickly, we can't be complacent. Although we're in the top right now, we gotta stay vigilant because this virus can anytime come back. We didn't see it coming the first time. It will be our fault if we're not ready the second time if it's coming. And I know with the leadership of Jeff Fleck and the governor, we're gonna be ready. And essential workers, again, thank you for all you do. Hartford HealthCare was there when we weren't getting testing in other communities, viable communities. Hartford HealthCare was there. Jeff was there. His people were there. And that's why they're one of the #1 leaders in the state of Connecticut. And we're going to keep the pressure on and make sure our people are safe. And our essential workers, again, thank you for all the work you do.
Thank you. Thank you, Senator McCrory. Thank you, Governor.
Suzette, would you like to say something?
Please.
Thank you, Governor. Thank you, Jeff. Thank you, Senator. Thank you, Doncaster. As the mayor of this town, I'm grateful to know that Doncaster has been so vigilant in the COVID-19 fight. I do echo Senator McCrory to our first responders, our essential workers. Thank you, thank you, thank you. It's amazing when you have great leadership that can walk the walk and talk the talk. So thank you very much, Governor. We have been here fighting, and we will continue to fight. Hartford HealthCare, thank you for being on the front lines of that fight. We are doing well. Bloomfield, we're doing well. We still have to continue social distancing. We still have to continue washing our hands. We still have to continue wearing our masks. It's going to take a while for us to get through this, but we will get through this. The Army is strong, and the people are vigilant. So once again, thank you very much.
Thank you, Mayor. Often we talk about the frontline heroes in healthcare, and I want to bring somebody forward. I want to invite Keith Grant to come forward. Keith is the head of infectious disease, and it's our system-wide director of infectious disease for Hartford HealthCare. And since the first night of the very first patient who arrived in the first week of March, there hasn't been a day that's gone by that Keith hasn't been working hand in hand with places like Doncaster and every part of our institutions to ensure that we can manage the spread of this disease. And I think you'll hear today, I don't believe we've had a positive patient here for nearly 5 weeks, which is a real credit to the work that Keith and so many people do around the pristine focus and attention to practices. Please, Keith.
Absolutely. Awesome. Thank you, Jeff. So, when this started, one of the things that we asked for is how do we get information out to the community? And some people that we don't often get to thank, I think Tina and Rebecca and her team, with allowing us to get the appropriate information out as soon as possible. So the information was simple. Some key things. So proper hand hygiene and other infection prevention practices, wearing your mask and social distancing, right? Recognizing symptoms. This message has worked in Connecticut. 0.86 is a significant number. It's something for us to celebrate in the right way. Celebrate in the right way, social distancing. But it's a huge win for Connecticut, right? And one of the other pieces that we promised you.
Tell them what that number means.
Well, 0.86. Thank you. So 0.86. Let's shift that number. Let's say 2. Let's add 2. It's an easier number to work with. Let's say if the number was 2. So if I become positive, it increases the probability. So I'm more likely to pass it on to 2 people. So in the state of Connecticut now, 0.86 recognizes that the efforts that's been put in place by the Connecticut citizens, for every one person that becomes impacted, there's a lower probability of passing it on to a single person. There's no such thing as a 0.86 person, right? So it's a very low probability of passing it on to a person, and that's pretty significant. The 100,000 tests, what does that represent? It represents our ability to prove that what we ask you to do as Connecticut citizens, to stay at home as much as possible, to keep proper hand hygiene, to wear your mask and social distancing. This is our opportunity to prove to you that this has worked. And I can't thank Dawn and her team enough. I can't thank everyone within the community, all the infection preventionists, all the nurses, enough. But there's people who put all this together, and Jeff's a huge part of it. The governor's a huge part of it. Everyone within the leadership group. Jeff will consistently say whenever we call him, he says, do what you think is the right thing and do what the right thing is for the community. And we've tried to do that. And I'm hoping with everything else that we have as challenges, we'll be able to exemplify the exact same effort going forward. But I think this is a huge win, huge significant win for Connecticut, and I'm proud to be a part of it. Thank you so much.
Thank you.
Thank you, Keith. Keith's incredibly important to what we do here in Connecticut. We say he's our rock star during this time period because his work is so impactful, protects and saves lives. If I could ask Michael O'Brien. Michael's the president and CEO of Doncaster of this community, a long-standing partner to Hartford HealthCare, and has been a leader here for many years. Thank you, Michael. Please.
Well, thank you, Jeff, and thank you, Governor. I welcome both of you to our beautiful campus as well as the other dignitaries that are here today. Thank you, and thank you for the great job everybody is doing. As Jeff indicated, we've had a long-standing partnership with Hartford HealthCare. It actually goes back to the early 1980s, and today they provide the medical leadership. They have a medical practice right on our campus, and they have been with us every minute of the day since this whole pandemic has started, helping to guide us, helping us to develop policies and procedures, all with our efforts designed to keep our residents and our staff safe. I also want to thank the Governor for your incredible leadership, for your stewardship, for your communication, your messaging. It's been very effective, very direct, and I think it's obviously reflective in the good results we have here in Connecticut. I would also echo what everybody has said already, is that we know we're not through this yet. We know this can come back very quickly. The real difficult challenge for all of us here at Doncaster is because obviously we care for older adults who either live here or who live in our nursing home. And it's been very challenging for us to constantly say no, but we know that every decision we make is based upon information from CDC, from the Connecticut Department of Public Health, who has done a phenomenal job in helping us to get personal protective equipment and good guidance. Tremendous support from our state association, Leading Age of Connecticut. And also what's very wonderful about senior living has been the collaboration and the sharing of best practices. What's working, what's not working, how can we keep our residents safe, how can we keep our staff safe, but how also can we fulfill our mission, which is to make sure we enrich the lives who have chosen to live on our campus. And so personal responsibility has been an important message for us. We all take that responsibility very seriously. We know that working in senior living comes with an added responsibility. So we have done a lot of work of coaching, educating, communicating, always with care and compassion in mind about why we have to be so responsible as we come each and every day. And I do want to take a moment to thank the incredible team here at Doncaster, 350 strong employees who every single day have sacrificed personally to make sure that they do what they do really well, and that's to care for the residents who have chosen to live at Doncaster. So I could not be prouder. It's been the finest moment in my career here to see the response, the pivoting we do on a moment's notice, to take care of those who have entrusted their lives with all of us. And I would say that, we're testing today, we're testing all of our staff. We'll continue to follow those testing recommendations from the governor and from the Department of Public Health. And we know that testing is a great opportunity for us to develop the kind of strategies that we need to implement to develop policies and procedures to take care of those who live here. But we also know we have a personal responsibility on the bigger public health care issue, and that testing data can help those investigators, those epidemiologists, to use that information to characterize the prevalence, the spread, and even the contagiousness of the disease. So Doncaster pledges to continue to use testing as a strategy to mitigate the risk of COVID-19. The support from Jeff and his team in doing all the testing has been remarkable, and we will continue to fight this because we know this insidious virus is not going to disappear anytime soon. So again, I thank all of you for joining us today and for your tremendous work and leadership.
Thank you, Mark. So today we recognize 100,000 tests, but I want to bring us back. These aren't 100,000 tests. These are 100,000 people. Right? At Hartford HealthCare, we never discuss statistics without recognizing we're talking about somebody's mother, father, brother, sister, best friend. These are people. And we have now been able to provide 100,000 tests to 100,000 different human beings, which is absolutely critical, and we will continue to do that. My final point would be, so much of the discussion continues to be around us in the community about we want to return to normal. And everybody wants to return to normal, and we clearly want to return to normal in many parts of our life. But I want to be clear, in healthcare, we don't want to return to normal. We're going to be better than normal. The learnings through this pandemic have been extraordinary. There are so many things we can do better around health equity. There are so many things we can do around access. There's going to be so many ways to leverage new approaches to care for more people in different ways, more affordably. We're going to emerge, ultimately, better as a result of these learnings. We're going to do a better job as we go forward. We would be delighted to have anyone today within our team answer any questions we can before we conclude.
Governor, Chief McGilvery, Wisconsin 61. I wonder what this success in testing means for folks who want to know when they will be able to more freely interact and visit with loved ones at senior living facilities or nursing homes across the state of Connecticut.
Well, you guys can help me answer this. I can tell you we were very strict early on during the height of the pandemic. Now that the infection rate is a lot lower, we're working with the nursing homes in particular, make sure that we can get access there so loved ones can be able to see each other. We test or at least get protocols, same people going in and out. We're working with each and every nursing home, but those relationships are being reestablished safely.
What are your goals going forward? In other words, do you want to test another 100,000, or what are the goals? What are the parameters?
Well, we should talk to the chief epidemiologist here. But I think this is no time to take your foot off the accelerator, Chris. This is the time, I think, to continue testing. We're looking at pooling. We're looking at waste water. We're looking at different ways we can get early indications of what's going on in our community. As you heard before, there's a very narrow margin for error here. And thankfully, we're in a very good position now, but we want to be able to be ahead of the curve if there are any flare-ups. Would you like to add to that in any way?
I mean, I completely
Chief?
agree with you. I think the 100,000 represents our ability. That's basically it. So we have the ability to perform 100,000 tests very quickly. So considering what we've done over the last few months, this is an ability and a capability that we have and we'll keep expanding on. The more we test, the more we know. In order for us to make good predictive models, in order for us to answer the initial question, when is it safe to go back into the nursing homes, for example, we need to keep testing. So it's not, this is just a representation of our capability at this point in time.
Great. Thank you, everybody.
I was pausing The president is back tweeting this morning saying that our numbers are such with positive cases because we're testing significantly more than other countries. In the last 24 hours, he's also talked about withholding education funding to communities that don't have kids back in school come the fall. What's your general reaction to what he's had to say?
When it comes to higher infections because of more testing, I'm talking to the healthcare professionals. That's who I'm listening to every day to make a difference. And when it comes to withholding funding for schools and the such, I think he said it 3 months ago. Let's let the governors make that determination. I don't need to have that imposed by the feds. Here in the state of Connecticut, we're in relatively good shape, and if our metrics stay good, we will be able to open our schools safely. I think I'd hold off if I was in San Antonio or Phoenix or Miami right now. Thanks, everybody.